I'm so thrilled that we're here with Kayla and Tammy talking about what families should expect from their SCN8A clinicians. And this is what was built as consensus across all of the clinicians and clinicians and families who were involved in this process about, what really families have the right to expect when they're seeing a clinician who's treating their child that has SCN8A. So to begin with, let's just quickly hear from who everybody is. My name is Gabi Conacher, and I think you'll hear from me, but let's hear from Tammy.
My name is Tammy Koistra. I'm mom to Liam. He's 9.5.
My name is Kayla Waldrop. I'm mom to McKinley. She is 4.5 years old.
Terrific. Well, thank you both for joining me, and thank you both as core panel members on this process. So both of you put a great chunk of time into helping us do this process, meeting on a regular basis with clinicians to talk about, what we know about SCN8A and the kinds of things we want to build a consensus around. So you all played a key role in working with these clinicians around the world and other families to really build this consensus. So thank you both for your time there. And for joining me today to talk a little bit more about what families should expect. The first thing that there was agreement on is that clinicians should really have a sense that there is a wide range of diversity within SCN8A, including the 5 identified phenotypes in this consensus process. I mean, why do you guys think that's important?
Treatment. We feel like it's a big part in how you're going to treat your child and what to expect. So this would be drug resistant, if you might figure it out on the first try, or if it might take multiple meds.
We know SCN8A is even more diverse than that, right, Tammy?
Well, yeah, I mean, like with Liam, we know that he's a gain of function and he has seizures right away, but then you have children who get seizures later on in life or some that don't have seizures. So the treatment of these children are all different.
SCN8A is probably one of the most common neurodevelopmental disorders in terms of incidence. And what we're learning is that as more and more people get diagnosed, we're learning more about different kinds of SCN8A, right? Like we just had a family who posted on our Facebook page this week about her son who had onset of seizures at 27 years old. So that is not a phenotype that is identified here, but we know the field is always changing. And for now, we have consensus on these 5 phenotypes that do exist and a better understanding of how to treat them, as you've heard from some of these other presentations. Okay, we also have consensus that clinicians should really follow the research on SCN8A, right? Families should expect that if they are treating a child who has SCN8A, that they should be willing to do some research and better understand the disorder. What do you guys think about that? Any thoughts on why that's important?
And if I expect it in whoever our doctors are.
Yeah, if I take my child to a doctor, I would prefer they be, educated in SCN8A or at least willing to want to learn. That's a good start, right?
Yeah, absolutely. And the reality is that with a rare disease like SCN8A, right, there's less than 1,000 cases that have been identified to date around the world. Not everybody is going to be able to go to see a clinician that knows SCN8A. So finding somebody who's willing to learn, and frankly, the next one, which is listen to families, we bring an incredible amount of knowledge to the table as well as families within our community. And I think that next one, that a clinician should really listen to families and value the input that we have on the priorities of care for our children. Right, McKinley? Yeah.
She sounds like she's saying mom.
She's shy.
Yeah, right. I mean, so we've seen this come up a lot. We hear from families every week who are struggling with clinicians who are not listening to them or about what their priorities for care are. Why is this so critically important, Tammy, do you think, to have a clinician that listens to you?
Because if they're not listening, then you're not being heard. You're not going to get anywhere without that. So Hopefully, I have changed doctors because of this.
when you have clear priorities for how you want McKinley to be cared for, how do you communicate that with your clinician, and what do you do if they don't listen?
Well, if they don't listen, I find a new one. We're on our third, and I'm thankful that he is very open-minded and listens. I feel like a different approach than a lot of people. Knowing that she's on the more severe ends, I'm not as willing to try and fail as many things. I'm just kind of looking for quality of life and trying to find what reduces her seizures enough to still let her be happy and smile and interact throughout the day. And some doctors weren't as on that same page as me. And so, to me, it's a hard balance to figure out. And then I feel like just being the caregiver at home, I'm with her literally 24/7 since the day I had her. So for 4.5 years, like no one else is around. I feel like I notice a lot of funny little things that trigger seizures. And so I also need them to maybe not even bonkers when I say that, like that dairy and diet changes have actually helped so much, where early on dairy was the big trigger for her. And so just need to be able to feel like I can express those things without any judgment, and just really important to feel her to listen to.
That we know that SCN8A is complex, requires a lot of care from a lot of different providers. And so there was consensus that clinicians should provide referrals to early intervention specialists and complex care as appropriate, and hopefully as soon as possible, right? We know that things like speech and language processing and developmental delays are fairly common amongst those, even across phenotypes with SCN8A, and getting early access to that really matters. I mean, Tammy, you've been getting a lot of services. What is that?
We've had intervention since about 4 months old. We had physical therapy, OT. The school would bring that in also, and then we had it out of the house also. But I mean, the earlier you can intervene, the more the child may develop and, be able to do the things that you want them to do. But yeah, we started on really early.
I hope you don't mind if I say this, but I mean, you're pretty open about the struggles that Liam has with GI issues, and you've struggled to get those referrals and get things approved and find, so.
Yeah, I mean, we actually struggled. We actually ended up in the hospital because he started vomiting his formula up, so, which included his seizure medications. So we did get the referrals, and we never did get some of the testing that we needed to have done.
What about for you, Kayla, in terms of accessing specialists and
we used early intervention in the beginning, and we would do feeding therapy, speech therapy, and I think for me, in a lot of ways, I almost kind of had like a head start in that area because it's just my background in healthcare. But I do feel like it's so important to go and at least learn. Like I'm a first-time mom. McKinley was my first child, so there was a lot of things that I was just totally unfamiliar with, like what normal babies do. So to me, the things my child were doing seems normal. So whenever someone's like, no, actually, like she should be holding her head up and doing ABC, those are really important things that I kind of learned along the way that I didn't notice.
So one of the other things that's really important that there was consensus on that clinicians really understand is that they should be open to discussing SUDEP and bring up the topic with families and read the room, right? Like you bring it up. It's your responsibility as a clinician to mention that this is a risk. And then some families will say, don't want to hear about it. And that's their choice. And others will say, tell me more. I want to know what I can do. And it opens up that door for conversations. And I know, Tammy, you have a lot of conversations with families about these kinds of risks. Why do you think this is important to families?
Well, for me, I didn't know. Well, it was in my paperwork, the paperwork that you get when you're in shock and you put it away and you don't read it again. And it probably was mentioned to me, but I just probably didn't know what SUDEP meant, right? Mm-hmm. But I never heard or learned what it was until he was about 2 years old. So I thought to myself, if something had happened, I would have wanted to be prepared. Like for myself, I would have wanted to use a seizure monitor. You know, it's everybody's choice what they do, but for me, I would have wanted to know if something was going on. So I think it's really important to have the conversation with children who have epilepsy. You know, anybody that has seizures is at risk.
One of the other things that came up is that that there should be this ability and willingness to collaborate across specialists, right? Right. We all see GI and neuro and PT and OT and speech and all of these different caregivers. And oftentimes decisions are not just affecting one system and need to be, or there's new medications being introduced. Does that conflict with, or is that contraindicated against other medications that are in play? And so this was a really important area of consensus. And Kayla, I wonder what your thoughts are about care coordination and making sure that doctors are able to talk to each other.
I mean, my thoughts on it are, I wish it was better, at least where I am. I feel like that responsibility tends to fall on the caregiver for the most part, and it's a lot to take in. It would do it. I don't know if that's the right word to use. I don't want to say burden, but it would ease a lot of the stresses if you could count on your medical professionals to collaborate together and to pay attention to the med list on, okay, if we change this med, is it going to affect any of these other meds? Is it going to maybe increase or decrease like the concentration of it? And
one of the things that the International SCN8A Alliance has been working to really promote more within our community is the understanding of the need for a seizure action plan. And we got consensus through this process that clinicians really should take on a leadership role or a partnership role in helping every family have a seizure action plan. Now, anyone who has seizures or who's at risk of having seizures is the consensus should work with a clinician to have a seizure action plan, which essentially outlines what to do in case of seizure emergencies, right? Do you all have any thoughts on seizure action plans and how they can be of use?
I think they are really important to have in place.
Yeah.
Especially in school, if, there's got to be, people trained to be able to take care of your child and call the right people and do the right things, and get the right steps in place because, it's a matter of time with these seizures. You want to get an ambulance called if it needs to be done. At home, Liam doesn't go to school. But with the girls here, if he has a tonic-clonic, he gets rescue meds right away. If he doesn't and he has a small seizure that's not a tonic-clonic, we don't. But they always are, if I'm not available, calling me or contacting me right away. Mm-hmm. And we have this thing where if he goes into a seizure and it's not stopping, you call 911. So we have that, put in order here, but.
And I think that's so important is that it empowers the people who are caring for our children to better understand how to help them in case of emergencies. And one of the final areas of consensus about what SCN8A caregivers should expect from their clinicians is that they help develop and implement and carry out a transition plan moving from pediatrics to adult neurologists. And we know this is incredibly important because of the reality is that there are not a lot of adult neurologists who are familiar with rare disorders like SCN8A. So I think this is an incredibly important one for families to feel empowered to say, I know this transition is coming. I would like you to help me make this as smooth as possible. None of us on the call today have been through that, but we know of others who have and how important that is. Have you heard any stories or heard any insights about the power of having a smooth transition? Either of you?
I haven't, but I can say that is a terrifying thought, just as a parent, to have to completely switch everything over in 18 years to someone else. And it would be really hard. So it would be nice for that to go as smooth as possible.
Mm-hmm.
I mean, I've experienced it with my daughter with her type 1 diabetes. Yeah. It was way different switching from an endocrinologist that dealt with her whole life, and then all of a sudden we're at a doctor that knows nothing about her. So, I mean, I've experienced it in that way, but I haven't experienced it with Liam yet.
I think it's so powerful to, for you all as caregivers and advocates to have been a part of this process and to share your insights, go through this whole process, but also today in this session to help families better understand what they really should understand they have the right to and have the right to expect from their clinicians. Is there anything else either of you wants to say about this process or about what we went through today?
I'm just really excited that it's happening. I remember when we got our diagnosis, and the first thing I did was go to Google. We were actually inpatient, and it was the first day she started having infantile spasms. So we were hospitalized. I got the genetic results that same day. And so it's nice to have that reason why, but then you Google it and you find like nothing. So I'm excited there's going to be this like quick and dirty rundown on things for clinicians, but also us.
Yeah, I'm excited too. When we got our diagnosis, he was 2 years old. So for 2 years, we kind of were flying, blinded, right? And then I get this diagnosis, and then I think to myself, we Googled, we did the same thing, and it was really scary. So I'm just hoping that people don't feel so blinded like I did. When we first got the diagnosis, it was so rare that there wasn't a whole lot of information. So, and I imagine as we keep researching, we're going to get new things coming up, and, new ideas and new treatments, and hopefully a cure one day,
Yeah, definitely working towards that. Well, thank you both for joining, and so grateful to get to work with and be friends with such amazingly strong and smart women who are leaders in the lives of their children and our community. So thank you for everything that you've done and continue to do.
Thank you.
Thank you.